Okay, Ohad Hershkovitz here again, and this is the third video on OCD, and in this video I'll be talking about behavioral therapy. So we already discussed in cognitive therapy how we want to challenge the assessment that certain thoughts are wrong or dangerous and that we need to fight them or stop them. Now, that's easier said than done, and the patient may understand that on a theoretical level. But on a practical level, we'll often find that the patient has trouble coming to terms with that because it's so uncomfortable for them emotionally, and they're not used to just tolerating that emotion. They're used to responding to it. That's become a very automatic response for them. So suddenly switching their perhaps lifetime habit of fighting or avoiding or trying to calm down uncomfortable emotions and thoughts, suddenly asking them to just sit with it and accept it and tolerate it is not that easy. And so this is where the behavioral therapy comes in. So in the behavior therapy, what we want to do is actually help them experience this practically. The most common tool obviously being exposures, where we expose the patient to a stimulus which triggers an emotion and an uncomfortable thought and possibly physiological manifestation of emotion and a behavioral impulse. And then we would ask them, when we provoke it, these emotions with some sort of stimulus, we would ask them then to try to wait and prevent any sort of fight or flight response, prevent the compulsion, prevent trying to achieve mental certainty or calm, and trying to make any sort of conclusions about the thought, trying to avoid it or stop it, or do anything else to relieve the discomfort. But just wait and see what happens to this emotion when you do in fact wait. And as patients discover, when they allow themselves to experience the emotion without immediately responding, then obviously the emotional process in the brain, the physiological process, is one of dissipation and then habituation with repeated exposure, which only breaks when they interfere by exacerbating their emotion with secondary emotion by offering some sort of negative evaluation or judgment or criticism. So as they allow themselves to experience the primary emotion without responding, they discover that, first of all, indeed, those emotions do not translate to real-world risks. Secondly, that they are in fact able to tolerate the different manifestations of emotion. And thirdly, that when they don't interfere, those manifestations actually dissipate with time and come back less and less with repeated exposures, vis-a-vis habituations. Now, obviously, some exposures are very difficult and emotionally overwhelming for the patient, so we wouldn't want to start with those exposures. We'd want to start them with easier exposures, which trigger lesser intensities of emotion, and build their confidence gradually so that they can see that they're able to tolerate lower levels of anxiety, and that it does dissipate. And then as their confidence grows, raise the weight of the emotion to middle levels and then gradually to higher levels. Kind of like a metaphor that I use often is working out in the gym, where you wouldn't immediately start out with the heaviest weights. You start out with the light weights, build up your strength, and then move on to the medium weights and the heavy weights. And often the primary symptom that the patient brings to therapy would be one of the heavier weights, one of the most challenging, which is the reason why they're bringing that to therapy. So we might not immediately start with that particular exposure, or we might take that exposure and break it down to sub-exposures, creating a gradual hierarchy. For example, if a patient has difficulty with washing hands, we might not immediately ask them to stop washing their hands, but rather postponing the time they wait before they wash their hands, maybe waiting 10 seconds, then 30 seconds, then 1 minute, then 5 minutes, then 10 minutes, then half an hour, then an hour, and so on. Or we might ask them to change the procedure in which they wash their hands. Instead of washing it for 10 minutes straight, perhaps washing it for a minute at a time, and then taking a break, and then resuming the wash if they need to, and then taking another break, and slowly building their tolerance for not receiving that complete satisfaction, but on the other hand, not completely taking away their compulsion before they're ready for it. So any exposure can be manipulated, can be substituted, can be broken down to make it easier for the patient to gradually go through this process of experiencing uncomfortable thoughts, sensations, and behavioral impulses via the various stimuli, and then discovering that they can tolerate it and it's not dangerous and it does dissipate. So the behavioral therapy of exposures actually complements the cognitive therapy, which is more theoretical for the patient, but doesn't help them with real-world tolerance for that emotion. And so the two go hand in hand really nicely to help bring together theory and the practice. And then obviously we send the patient out into the field to practice in between sessions, building that tolerance during the week. So that's the prime element of behavioral therapy for OCD. Obviously, we should complement it, at least as I've described it, with cognitive therapy. There are other protocols that focus only on one or the other, but I've presented here a combination of the two. There are other elements to the behavioral therapy as well, such as behaviors that focus on triggering more positive emotions and building self-confidence with their emotions. And I may talk about that in a separate video, but the exposures are the prime tool. So once again, if you have questions or comments, feel free to write them in below. And if you're watching this outside of the CBT Nest community and you are a therapist and would like to join, head on over to social.cbtnest.com and apply to join our free community of therapists focusing on CBT, where we have discussions, case consultations, therapy tools, online courses and webinars for CBT.